Hello, everybody. Just wanted to say thanks for hopping on this Pregnancy Essentials webinar. And I want to respect your time, so I will go ahead and get started here. So again, we're doing the Pregnancy Essentials webinar here today. Little information about myself. So my name is Dr. Jill Mork, and I am a prenatal and pediatric certified chiropractor. So I own Family First Chiropractic of Verona here in Verona, Wisconsin. And really my purpose with all of these webinars and everything I do is to empower families so that they can take control of their health and so that they're educated and confident in their health decisions. That's a big thing when it comes to families is, healthcare can be a confusing route to decipher. So usually when I have patients in my office and I'm going through some things with them, I often hear, why didn't someone tell me this sooner? And that's really what I'm trying to prevent, is I just want to get this information out there so that you have some other ideas or just information that you can think about and decide what's best for you and your family. So what we're going to be doing here is going over some key things regarding the preconception period, and then we'll dive into 5 different essentials that will allow you to have the best pregnancy possible. So we will go ahead and just go right into preconception. So unfortunately, these days there are a lot of couples that have issues getting pregnant. And what it comes down to is that, barring any major medical issues, if you truly do live a healthy lifestyle and you're not actively preventing pregnancy, getting pregnant should really be a side effect of that healthy lifestyle. And you've probably heard this before, but things like good nutrition, sleeping enough and sleeping well, getting proper exercise, minimizing stress, and having a positive mindset are all key factors when it comes to having a healthy lifestyle. And that's for both mom and dad, not just mom. And so, a woman's body was literally made to bear children, but unfortunately some of our lifestyle choices have been getting in the way of that. What it comes down to is that the health of the eggs that a woman will release is determined 120 days prior to ovulation. So, 4 months before you conceive or before you get pregnant is when the health of those eggs are determined. So therefore, it's really essential that you just make that conscious effort to nurture the environment that those eggs are growing in at least 4 months before conception. And really what it comes down to is the biggest thing that I see that will decrease the odds of conceiving is the inability to adapt to stress. And that, again, is for both mom and dad. And I'm going to tell you kind of what I mean by that. So your nervous system is what perceives stress and then coordinates the behavior of the rest of the body. And that includes all of your reproductive organs. So you have 2 different modes of your nervous system. One is called the sympathetic side of the nervous system, and the other is the parasympathetic side of the nervous system. And we call the sympathetic side kind of that stress mode, or I like to call it the gas pedal mode. And the other side, the parasympathetic side, is like the brake pedal mode. And so the important thing to note with that is, I have a little handout here, hopefully you can see it. So really it's balance in that nervous system that is important. So with that, we have the sympathetic side of that nervous system is, like I said, your stress mode. So it was literally created so that when you have a stressful situation, you kind of switch into that mode, overcome that stress, and then kind of go back into balance. And so the issue with that, though, is that we have so many different stressors, this kind of low-grade, constant stress that's being bombarded, that's bombarding us all the time. That includes physical stress, chemical stress, and emotional stress. So all those stressors are piling up and causing people to get stuck in this sympathetic stress mode. And all of your stress hormones are released in the stress mode, and that's dictated by that nervous system function. And one of the keys is that there's an inverse relationship between these 2 modes. And so that brake pedal mode is so important because that mode is your resting mode, your healing mode, digesting mode, proper immune function mode. And the big one here, when we talk about pregnancy, it's the growth and development mode. So when you're stuck in your sympathetic mode, that parasympathetic mode is shut off, and you're really gonna decrease your chances of conceiving at that point. And so it's really important that you really make sure that you're not stuck in that stress mode. But you might be asking, well, how do I know that? So at my office here, we do nervous system function scans. And these nervous system function scans show exactly what's going on in the body. I do have an example here, so this is actually my scan. What we see here are different pictures, and I'm not going to get into too much detail about these scans, but really what it's all about is that it shows kind of if you're stuck in one mode versus the other, if you're able to adapt to different stressors, and if you have stress on your different organs and glands, and how your muscles are responding to that stress as well. So that's a really important thing to think about when it comes to health when you're trying to conceive. Because if there is stress on there, that can definitely impact your chances of getting pregnant. And then there are some other key factors regarding lifestyle to create that healthy environment for pregnancy. And really those are important when you conceive too. So I'm going to cover those in just a little bit here, which kind of brings us to more the pregnancy discussion here. So there's 5 different essentials I'm going to go over that will really lead to the the healthiest, happiest pregnancies for mom and baby. And so really what's important is that really you have the birth outcome that you desire. So one essential that I'm going to talk about first here is choosing your birth team. So we do have some great options here in the Madison area, and that's not just for the birth, but for the entire pregnancy. And one of the things that is really disheartening when I hear from patients is that, if they didn't have the birth outcome that they desired, they'll say things like, my provider didn't let me do this or that, they wouldn't let me go past my due date, they wouldn't let me stay mobile and upright during labor. And really, what I like to tell people is that you have a choice who your provider is. Your provider works for you. So if you are not comfortable with some of the things that they will or will not let you do, you can always find a new provider and see if they are a better fit for you and what your desires are. And so typically the main provider is an OBGYN or a midwife. There are a lot of great midwives in the area here. We have a couple that are actually affiliated with the different hospitals. So we have the UW midwives, and then we also have the Madison midwives are great. And there are a handful of home birth midwives too that are amazing. Another thing that you might want to consider to have on your birth team is a doula. And so if you don't know what a doula is a trained professional, not trained medically per se, but they're trained to give physical, emotional, and informational support to a mom. And that's going to be for before, during, and after childbirth to really help her achieve the healthiest, most satisfying birth experience possible. When it comes to other people on the birth team, so if you have a spouse or a significant other, that's someone else that needs to be on board with your wishes as far as birth. And then birth instructors can play a big role too in having the outcome that you want for pregnancy and labor and delivery. So especially if you are looking to have an unmedicated birth, I highly recommend doing an independent birth class that's not affiliated with a hospital. So there's 2 that I really like that I recommend to patients a lot, and that would be the Bradley method of birth or hypnobirthing. So if you are looking for more resources, you can look into those. And then the last person that's really important to have on your birth team is a prenatal chiropractor. You probably knew that was coming since I'm a chiropractor here giving this webinar here. But what's important when it comes to a prenatal chiropractor is that not all chiropractors have the same training. So one thing you absolutely want in a prenatal chiropractor is you want them to be certified in the Webster technique. And so the Webster technique is a specific technique for pregnancy that we'll talk about a little bit later, but it's really important that they have been certified in that, as well as a chiropractor has taken additional training or classes when it comes to pregnancy. Obviously, this is a very special time for you and your family, so you want to have the best possible care for yourself and your baby. So that brings us to the second essential for having the pregnancy that you desire, and that is empowering pregnancy literature. So really what you need to do is fill your head with positive birth stories, empowering birth outcomes, different books about finding your support system, and things that are congruent with the birth process that you desire, whatever that is. And so there is one book that almost everybody gets that even, I actually got from a well-meaning friend. It's called What to Expect When You're Expecting. And if you have that book, my best piece of advice for you would be to take that book, walk over to the trash, and throw it away. So really that book, it's really disempowering and talks about everything that could go wrong. And that really starts the cascade of different stressors in mom, kind of puts her on edge, maybe brings in some anxiety. And we need to be more empowered and have more positive stories going on. So what I'm going to do is I'm going to go through 5 different books that I really like for pregnancy. And I have all these actually in a lending library at my office. Some of them are checked out, so I don't have all of them here with me, but I'll quick go through a few. So the first one is Ina May's Guide to Childbirth. And Ina May Gaskin is actually a very well-known midwife. She's known as the godmother of midwifery. And so she's written several books. So this is actually her breastfeeding book, but her guide to childbirth looks very similar on the cover. But it is a great resource. So it's kind of divided into 2 different sections. So the first section is all about different things as far as, what happens during labor and delivery, so you can be more informed. And then the other part of it is it's all about different birth stories. So just positive birth stories. That's a really great read, and it's an easy read in general. It's nothing like too complicated. You can get through it pretty quickly. So I highly recommend that book. The next one that really I think should be almost seen as like the Bible of pregnancy is this book right here. So this is called Mama Natural's Guide to Pregnancy and Childbirth. So what this is it goes through week by week, kind of what's going on with mom, what's going on with baby, and then all these different things that, different tests or different things that might be brought up at different prenatal appointments or things you might be thinking about. It really just kind of goes over the pros and cons of everything. So you really just get all the information, and that way you can make the decision that works best for you and your family. So that's what I really love about that book. There's also a section on different questions to ask a birth provider. So if you're still looking for a birth provider, or maybe aren't happy with the one you have and want to look for another one, it goes through a good checklist of different things that you can ask a birth provider to really make sure you guys are on the same page. And then there is a little section about after baby's born too. So it's just a really great book. Yes, it is a thicker one. It's pretty thick here, but there's a ton of great information in there, and I really love it. I wish it was around when I was pregnant, but it was not, unfortunately. So we'll go into the next book that I recommend, which is called Well-Adjusted Babies. So this one is great. It's written by actually a chiropractor from Australia. Her name is Jennifer Floriani. She's very well known, a very big advocate for health and wellness with pregnancy, with babies, children, families in general. And it goes through all sorts of things, prior to pregnancy, during pregnancy, after pregnancy, just so many great things in there, and even just different things about raising healthy children in general. So it's an awesome resource to have. The next 2 books I don't actually have here. A couple people have lent those out, but another really good book is called The Birth Partner. And so that is a great book for your support system to read. So if you have someone, whether, like I said, a spouse, significant other, maybe mom or a friend that's going to be at the birth, it really just kind of goes through different things as far as what to expect, and it's just a good resource for that birth partner that's there with you. And then the final book, it's called The Fourth Trimester, which it's all about kind of after baby's born and really how to kind of bounce back physically and mentally. And really, unfortunately, mental health in the postpartum period is kind of overlooked, and it's a really good book about some different things to consider when it comes to that. So I really do like that book, The Fourth Trimester, as well. So when we move on to the next pregnancy essential, so this one is all about lifestyle. And so a lot of this stuff will also relate to preconception, like I mentioned before, because the lifestyle factors prior to having a baby and while pregnant are very similar. But really have to think about how are you supporting that healthy lifestyle. And there's really a couple big things when it comes to that lifestyle. And the first thing is proper nutrition. So nutrition is huge, and the biggest piece of advice I can give anyone, really whether they're pregnant or not, is to eat real food. So cut out that processed junk. Really, it's not doing yourself, your baby, your body any good at all. And so just eat lots of fruits and veggies, some good kind of whole grain complex carbs, quinoa, rice, those kind of things, that's great. And making sure you're getting good healthy fats, and just making sure, especially with pregnancy, that you're maintaining your energy level. Oftentimes pregnant women don't realize they should eat, multiple small meals a day, not just if they're feeling nauseous, but just in general, because that will keep their, blood sugar levels kind of balanced throughout the day, and then also can prevent any big dips in blood pressure that could cause them to kind of feel faint or dizzy. So eating multiple small meals a day is a good idea too. One of the misconceptions too is that when you're pregnant, you get to eat a whole bunch of extra food. And really what it comes down to is you only need about 200 to 400 extra calories depending on your stage of pregnancy. So just be aware that it doesn't mean you can just eat whatever you want or however much you want, but make sure that you are trying to maintain that healthy pregnancy by having proper nutrition. And so another important thing to do is to get enough protein and water. So water is huge. Even if you're not pregnant, my recommendation is always take your body weight, cut it in half. That's how many ounces each day you should be drinking, which, come to think that, I should have some water right now. But when it comes to that, when you're pregnant, you should even drink extra, so more than half your body weight in ounces of water. And so that's really important to, again, that helps maintain blood pressure, really keeps the fluid levels in check in the body, so that's great. One diet that is specific for pregnancy is called the Brewer's Pregnancy Diet, like the Milwaukee Brewers. So Dr. Brewer came up with this diet to really help support healthy pregnancies, and he found that it actually helped decrease the risk of preeclampsia as well. So he kind of outlines eating, lots of fruits and veggies, whole grains, a kind of a balanced diet there, but also getting at least 80 grams of protein in a day, and then using a good quality salt to taste. So a lot of people have this fear of eating too much salt during pregnancy because they think, oh, I'm going to swell up, and oh, it's going to cause preeclampsia. But that is true when it comes to different processed salts. So really you shouldn't have processed foods, don't be eating a bag of potato chips or anything. But a good quality salt, I really like the pink Himalayan sea salt. That's really good to have all those nutrients and minerals in a good quality salt to help support your blood volume during pregnancy, because your blood volume actually almost doubles while you're pregnant. So you need to maintain enough salt in there to keep everything as far as blood pressure in check, to make sure that you're getting the proper nutrients from that good quality salt. So that's really important. The other thing I'm going to cover here is actually supplements to take while pregnant. And a supplement is just that. It's a supplement to a healthy diet. And unfortunately, even if you have the best diet, studies show that our food is depleted of the nutrients and minerals that they used to have. So really it is necessary to supplement with that. And a lot of people will get, like a prenatal vitamin, multivitamin kind of thing. But unfortunately, there are a lot of poor quality prenatal multivitamins available, like at places like Target, Costco, that kind of thing. And so things to look for would be, I really like whole food multivitamins. So I have this one here at the office. It's called Innate Response. It's a baby and me multivitamin. And it comes from whole foods, and then it also has folate in it rather than folic acid. So that's another big thing. Folic acid is actually synthetic, and most people have a version of a gene mutation that they actually cannot break down folic acid properly, and it actually builds up and can become toxic. So when you look at a prenatal multivitamin, you need to make sure it has folate or what's called a methylated version of that. And so it might say, I know on the one I have here, it says 5-MTHF. So basically it's a partially broken down version, so your body can actually absorb those nutrients, and baby can also utilize those nutrients there. Another big thing to take while pregnant is a DHA supplement. So DHA is a form of fish oil, a form of omega-3 fish oil, which is a good kind of fat. And it's good, fish oil in general is good for inflammation, heart health, brain health, but especially in pregnancy and while breastfeeding. It's really important because the DHA is very vital in developing baby's brain. And so it's a good idea to take a good quality DHA supplement. The other two ones that I always recommend as well would be a vitamin D. This is just a liquid version of it. A vitamin D supplement to just help with general health, and then a good quality probiotic supplement that has multiple different strains of probiotics. This one has a dozen different strains. You want to make sure that you're promoting good gut health, because that will set the tone for baby's gut health when they're born, and that will just set them up for having good immune health in the future. One other thing I'm going to just briefly mention is sleep. I know it's not really nutrition related, but sleep is really important too when you're pregnant, because you need to get enough rest. You know, you're going to be carrying on some extra weight usually. Your body's changing so much. You need to listen to your body and rest, and making sure you're getting enough sleep to support having that healthy, relaxed pregnancy. So then the other part of lifestyle I'm going to talk about is exercise. So exercise is very important for anybody, but even if you were not active before you're pregnant, that does not mean that you can't exercise while you're pregnant. That is a common myth that's out there too. So, you know, as always, certain modifications should and can be made to exercise to make it safe for pregnancy, but it's really important that you do exercise. So our culture, it tends to confuse pregnancy with a disease or disorder, or really something that kind of limits you, but that's not the case. So your body was made for this. You know, it's perfectly safe for you to be active during pregnancy, and it actually leads to easier and safer labors and deliveries. So movement is key to growth and development, so it's really important for both you and your baby to be exercising. And so as far as options, you know, you don't have to be running marathons or like spending hours at the gym or anything to get the benefits of prenatal exercise. Some of my favorites are prenatal yoga, whether that's at home or at a yoga studio. I really like Dragonfly Yoga here in town. They have a mild room, so it's not a hot yoga room, it's a mild prenatal yoga class. And simple things like going for walks, especially outside, is great. You know, with the weather warming up, it's always a good idea to get that fresh air. And even if you did like a more high intensity exercise before you were pregnant, you can still continue to do that as long as you do it safely and make the modifications as necessary. So I like to go to Burn Boot Camp in Verona here, and they are awesome at modifying. I see so many pregnant women there, and a lot of them, like, they're working out on their due date. And it is safe and it's effective to exercise at that high intensity, which is like a high intensity interval training. It's okay to be doing that. It's just a matter of, you know, making the right modifications. And if you don't know how to modify it, find someone who can help you with modifications of certain exercises. Some other just general exercises that are really good are core and pelvic floor exercises, especially like squats. So squatting is great. That's something you should do every day, especially while pregnant. And that really helps open up the pelvis and is great for building up that those muscles, just to kind of help with labor and delivery in the future. And then the last resource I'm gonna quick mention is called spinningbabies.com. So that's a great resource. They have a daily essentials exercise set of videos there that I highly recommend checking out if you haven't done so. So I'm gonna kind of just keep moving along since we're getting close already to that half hour. The number 4 essential I'm gonna talk about is creating a birth plan and a support system. So really, you know, you have to evaluate what you want out of your birth. So don't let others' opinions, expectations, or really the culture surrounding birth affect what you truly want out of that birth experience. And obviously it's okay to ask opinions if you're, you know, seeking out information, but really the biggest problem with birth is that if you let fear and the negative things that others say affect your experience, that's really what I see that leads to a lot of regret surrounding that whole birth process. And again, you know, birth is unpredictable, but I do see a lot of moms that they'll get angry or disappointed with the decisions that they made after the fact. Like they wish they had, you know, would have done this differently, or they wish they would have known that, which is why it's so important to arm yourself with information so that you know the options you have and that you can make a plan and set the intentions for what you want for your birth. And, you know, you have to have realistic expectations too. But really, if you know, surround yourself with people that are going to help you, that'll just really help support you along that journey. And I'll say here too, you know, if there's someone you don't want at your birth because you know that their energy is not going to represent what you feel is best, then don't have them there. So, you know, this is all about you and your baby and what you need to protect yourself, and make sure everyone within your circle knows and respects your wishes. And as far as, you know, like a birth plan, I actually just heard this from a colleague recently. There's a resource, if you go to motherboardbirth.com, that is a great resource for creating a birth plan. You can see all the different options and pick and choose kind of what you feel like you want for your birth. And so I'm going to go to the one last essential here. And that essential is chiropractic care during pregnancy. Obviously, you knew that was coming because I'm a chiropractor here. But a lot of moms are going to ask me, when's the best time to start chiropractic care during pregnancy? And my answer is always going to be right now. So regardless of where you are in your journey, right now is the best time to start. So like we mentioned earlier, that nervous system is what controls every function of the body. And a mom's nervous system is what dictates the function of a baby's nervous system. So by utilizing that chiropractic care throughout pregnancy, we're making sure that everything is functioning at its best. And so if you want to know of a common time where I do end up seeing a lot of new pregnant moms, that's usually around the second trimester. And typically that's because your body, goes through so many changes over a 9-month period. And usually that second trimester is when you start to see things show up. Because if your body isn't adapting to this well, this is when it kind of tends to catch up with you. So that's kind of a common time there. But I do see that, now that my office has been actually open for almost a year now, I've seen several women get chiropractic care before and throughout their entire pregnancies. And their birth stories, they have such great outcomes. And that's because they're better suited to handle the stress that pregnancy puts on their bodies. And that's really the experience I want for every mom. Another thing to note is that it's really never too late to start chiropractic care during your pregnancy. And, I've seen women actually start like in their 38th or 39th week of pregnancy. We'll still help and support them in any way we can to really help prepare their bodies for the rest of their pregnancy and birth. Obviously, if we do have more time to kind of unwind some of that stress and unhealthy patterns in their nervous system, it's always going to be better. But, I can still help at any stage of pregnancy. As far as the benefits of prenatal chiropractic care, I already mentioned the Webster technique earlier. So that technique is a specific pregnancy technique that helps align the pelvis and all the structures around it. And that really helps baby get into the best position possible. So I always like to give an analogy like a hot air balloon. And I have one little picture here to show you that kind of ties it together. So this is a side view of obviously a pregnant woman's body. And when we look at this, we have the uterus here. And then we see these different ligaments. So there's this one ligament right here. It's kind of hard to do this on here, but this is called the round ligament. And then we have another ligament over here called the uterosacral ligament. And you can see their attachments. So this one attaches to the front of the pubic bone. And then this one over here attaches to that sacrum, which is part of the spine that we work with. Now, when you have different ligaments that are under stress, whether it's from, sitting at work a lot, maybe you have a toddler at home that you're having to lift up or play with all the time, bending, twisting, stress gets on that body, and that causes everything to kind of tighten and shift. So with chiropractic care during pregnancy, think of that uterus as like a hot air balloon, and then those different ligaments as like the ropes that hold that hot air balloon to the basket. Whenever there's twisting or torsion, that hot air balloon isn't going to fill up all the way, and therefore the baby doesn't have as much room to move around, to grow, that kind of thing. So with chiropractic care, we help realign those structures. We work with the ligaments, the stress and tension of the ligaments, and that really helps balance that pelvis and gives baby the best possible position for birth. Another benefit of chiropractic care is decreasing pain and discomfort. And then research actually shows that labor times are decreased for moms that are under regular chiropractic care while pregnant. So that's always an awesome benefit. And really allowing your nervous system to respond and adapt to stress properly is the biggest thing with chiropractic care. Unfortunately, we are seeing babies being born that are hardwired for stress because mom wasn't able to adapt to stress effectively during pregnancy. So like we kind of mentioned before, babies get their neurological wiring from mom. So it's really important for mom to actively work on calming down their stress response. And so again, that's where those nervous system scans come into play. At my office, we can assess, measure, and quantify how much stress that nervous system has on it. And then we can put the best plan in place to overcome that stress. So all of that being said, my goal is really just to help moms prepare for the best. We can only control so much when it comes to birth. And really though, if we surround our pregnant moms with positive stories and support them every step of the way through this journey, really they can have the pregnancy and the birth that they choose. That way we can really have a big impact on mom's health and baby's health. when we know better, we do better. So that really is why I believe education is so key here. And I hope you did learn a lot on this webinar here. You know, we're just hitting that half-hour mark, so I'm kind of right on schedule, which is great. And really, I would be honored to help you during your pregnancy and help you along with this journey. So please, you know, reach out with any questions. I'd be happy to answer them. If you need any more information to one of the resources that I went over, whether it's, you know, the books or the websites, just again, you know, let me know and I'd be happy to give them over to you. But otherwise, I hope you feel more empowered now to take control of your pregnancy, and I hope you have a great rest of your day. Thanks a lot, everyone.